Dr. Uma's podcast is a series of podcasts providing career advice, work-based tips and learning skills, helping you become a better doctor with a healthy work-life balance. These podcasts are in association with MRCPCH speciality courses, who specialise in courses in interview skills, application form writing and communication skills. Check it out on mrcpch specialitycourses.co.uk. Hi everyone. Welcome to this video, and what I'm going to talk about quickly is that thing that we always get told at work. You should read about what you're seeing because you'll remember it better. They're absolutely right. You should read what you see within 48 hours because you're more likely to remember it and you're more likely to implement it at work. But what they don't tell you is what should you read and with what intent. So that's what I'm going to cover right now very quickly. So first things first, should you be reading big textbooks? Probably not. You're probably going to waste a lot of time. Now, reading what you see should be a relatively quick process because we're very busy. As I always say, we've got other things going on in our lives. So you don't want to spend a whole day or whole evening reading about bronchiolitis or asthma, or maybe there was a rash that you saw, a swollen joint, whatever it may be. You want to spend sort of maybe 20 minutes, get a good idea, help you think about what you saw and equip you for next time. Thin textbooks are really good. I was told by my professor that actually they are the best books because they're quite concise, they get to the point and they take out a lot of the faff. However, you're at a level now in your training where you've passed your medical school exams, you know the cause of various conditions. What you really want to know is, how do I manage this patient? What are the complications I need to worry about? And how do I manage those complications? So leave textbooks to one side. You could read your Oxford Handbook. That would give you a brief idea. But other than that, move it to one side. What you should be looking at are guidelines. So whether they're local guidelines on your internet or whether they're regional or national guidelines, get familiar where you can find them and what guidelines actually exist. By knowing them, and reading them, you'll be able to actually, number one, have a brief introduction of what the condition is, and that will cover that. But secondly, you'll know how to manage the problem. At which point do you initiate management? For example, I talk to a lot of juniors and I say, okay, you've got a broncholytic patient, you've admitted him, you've done the right thing, but when are you actually going to initiate high flow vapor therm? When are you going to decide, actually, I need to use CPAP, or when do I intubate? And that's where people get really confused and they say, well, I'll ask my registrar. But why don't you know? Because what it is, you focus on this idea of, I just know the condition, I know what the red flags are for keeping them in, and that's great, but I've sort of stopped there, and I'm not really looking into how do I escalate my management plan, because I've relied on my senior. But you are going to be the senior soon, so you should get in the habit of asking yourself those questions. And to be honest with you, it's not massive rocket science, it's stuff that's written there in the guidelines. And the earlier you familiarize yourself with it, the more confident you're going to feel in the workplace. So don't rely on someone to teach you. Go and seek the knowledge yourself. So local guidelines will tell you that, and also are really good because they tell you how things work in your hospital. National guidelines are absolutely very good because, again, there's no arguing with national guidelines. If they've been written by an official body, those are the guidelines you should be following. They tell you in a lot of detail about how you manage the problem, how you escalate care, and who you should be getting involved. So guidelines are your friend, and get used to using them, and they will help you in developing into a more independent clinician. Other than that, what else could you use? Review articles. Review articles are really good because they give you, again, an understanding of the condition, an understanding of associated conditions, differential diagnosis, and talk about the management. And again, I really want to highlight, make this a point that your next sort of stage now in your training is all about managing the patient. There is no doubt that you can take a history. You can take a history, you know what questions to ask, that's fine. But you really need to think about, how do I look after this patient? And I don't want to, well, it's not that you shouldn't. If you feel like you need to speak to your reg, speak to your reg. Speak to your consultant. You shouldn't feel scared to do that. And you shouldn't be in a culture that you're scared to do that. But it's about developing that confidence and moving on in your training. And the sooner you do it, the better it's going to be for you. Now, I hope that's been really useful. And again, it's not about taking a week off to read about every condition under the sun. Small chunks, consistently, it's going to be far more beneficial, and you're definitely going to remember things next time around. Anyway, see you in the next video.